the gateway to the West, Cardinal Nation. St. Louis, Missouri is home to some of the most brilliant doctors in the world. These doctors are pushing science to its limits, healing patients in new, innovative ways, and doing it at the same time they're teaching the next generation of doctors how to save lives. Meet SLUCare physician Dr. Howard Place, an orthopedic surgeon, and his team who specialize in correcting spinal deformities and trauma to the spine. This is the science of healing.
I was driving home really late one night, and I lived out in a rural area, and so I was driving on a country road and ended up going off the side of the road into the ditch and hit the driveway that went onto the farm and flipped my car trunk over hood 6 times.
So when Kayla came in, she was evaluated by our trauma department, and very quickly it was recognized that she had an injury to her cervical spine. That triggers a clear response in our level 1 trauma facility where the appropriate people are summoned to make immediate decisions. Having that available here 24 hours a day, I think helps set us apart from a number of different hospitals, and especially spinal cord trauma. They do a lot of spinal cord trauma for the region. With that, she had broken her neck. She was brought into our emergency room and was unable to fully use her arms and her legs, and the bones in her neck were displaced.
All of a sudden, I guess I started complaining about, not being able to feel my feet and not being able to feel my hands, and then it was kind of that fearful feeling of, this isn't normal, this isn't how I'm supposed to feel, and I knew something had to have been wrong because I had never felt that way before.
So we realigned the bones in her neck to take some of the pressure off her spinal cord, but they wouldn't stay that way. So what we needed to do is make a permanent change to those bones so that they would stay not putting any more pressure on her spinal cord. So we did a fusion.
He was very into just making sure that I felt comfortable, reassuring me, that he was going to take care of me, and just made us feel very comfortable before we actually went into the operating room later that morning.
Kayla initially had some significant deficits both in her arms and her legs, and profound weakness there, and by taking the pressure off her spinal cord, we gave her spinal cord the ability to recover and heal.
So there were definitely those concerns of just not being able to fix the paralysis, it causing more damage, because of the spinal cord injury, and then just not knowing what the outcome would be.
One of the real challenges that happens with people who have a spinal cord injury is their sense of doom, that life has ended, and that they'll never be able to return. One of the harder things that I have to do is address those issues for them when they don't have any real ability to recover, to give them that sense and kind of bring them to that conclusion, help them move forward. For those who I can be more optimistic, I am, and I try to be very positive in that regard as much as I can. I also push them pretty hard, as I do with some other folks about that. I have a brother who dated a quadriplegic. My sister's brother-in-law is a paraplegic, and so I deal with them. I work with them. They're normal people. They can come back and lead normal lives if they would like, and I try to help them get back to the best level of them that they can return to. And if I keep that in mind and try to let them know that there's a clear reason why they are still with us, and though they may not be the same, they're different. Everybody has a goal and a mission that they need to go ahead and do, and they'll serve in some way, if being an example or motivation for somebody else, and I try to be positive and help them in that area. So what we did is a surgical fusion by tying these 3 bones together so that they would then stay in that position to protect her spinal cord. This is what it looks like from the front. This is what it looks like from the side. And what that did was it provided the space for her spinal cord so it would not be injured further, and so that it had a chance to recover.
Working at a pain management facility brought me into the world of people who have these chronic disorders, and all I could think was, I'm not gonna end up like that. I'm gonna fight. I'm gonna try to do whatever I can. And so it was just kind of a mental thought of, okay, what can I do now?
And she's made an amazing recovery. She's very happy with her function, especially when she realized what she didn't have and where she is at the present time. And Kayla works in healthcare and really is very appreciative, and I think that's given her a new lease on life and how well she takes care of other people too.
I can walk, I go horseback riding once a week, I work full time, I work a PRN job, I'm an x-ray tech, so I wear lead skirt and vest around 10 pounds all day, a couple days a week, and just getting out there and trying to relive my life, connect with my old friends. So my left side has some stroke-like symptoms, so my hand doesn't want to open all the way on the left side. I have some foot drop, but I manage that with Botox every 3 months. And then I do physical therapy along with it and occupational therapy, so it's a work in progress every day.
So Kayla's condition would have led to continued decline in her neurologic function. She probably would have lost more ability in her arms and her legs. My guess is at this time she'd probably still be in a wheelchair. That injury in a place that doesn't have the ability to take care of spinal cord injuries like that, you see continued decline of neurologic function, and then that becomes a permanent change as opposed to a temporary change. And the residual deficit, the speed with which she was seen, evaluated, taken care of, made a huge difference in how much she could recover. And I think that's one of the important things that happens in our trauma center is those are recognized, and we can act on those expediently.
We really weren't sure what the progress was going to be. And for me to be able to walk into his office and to hand him a thank you card and to not have a walker or a cane, all I can say to Dr. Place is thank you for saving my life.
I had gone to the convent when I was 16, and then you needed a physical before you made final vows. So I was 21, and that was the first time I knew that I had scoliosis. And it was bad enough already in those days that they sent me to a surgeon, I remember on Grand Avenue. He told me that there would be a 50% chance that they would paralyze me in those days, because we're looking 60 years ago. And so I did nothing for many years. I wasn't in a lot of pain until I started like 30 years old. So then someone told me to go to a chiropractor, which I did. And the chiropractor told me immediately, I can't correct your curvature, but I can help keep you out of pain. And that was successful for a number of years. And then it got to the point, and that's what I tell other people when they come to me asking, how did you know? It's you can't stand it anymore and there's no quality of life any longer. I started looking for doctors. Besides Dr. Place, I went online, and at that time there were only 2 other surgeons in the whole St. Louis area that would even attempt this kind of surgery. So I called one of the others first, and when I called, I talked to the receptionist, and she was like, well, you have to be really, really bad. So one of our sisters had had surgery with Dr. Place about 5 years before, and she did well. And she was even older than I was at that time. So I just thought, I'm going to call Dr. Place.
Sister Marie was having issues with her back. Her scoliosis seemed to be progressing. She is a firecracker in a lot of ways and just continues to keep moving and serving and doing for others. But she was really being slowed by her back. She asked me whether or not I would be able to help her. She'd already been to 1 or 2 other docs who said, yeah, we're not going to do this, sister. This is too big a deal. Or she was only in her late 60s, and I say only in her late 60s. That's other people were telling her too old, and it's not too old. It's actually more your overall health. Her health was reasonable. She had tried a lot of things non-surgically to help herself, and we were able to make some improvement, but not enough for her to do what she'd like to do. So Sister Marie's back surgery consisted of being able to expose the bones in her spine to see what the crookedness was. She also then had a condition known as spinal stenosis, where she was having narrowing of the space for her nerves, so that Sister Marie had tolerated back pain for a number of years, but when her legs seemed to stop working and she couldn't stand or walk as far, then she threw in the towel and said, I have to get this changed. So we did a decompression for those nerves that were being squeezed, but in the middle of her crooked back, when we take away part of the support, if we don't reinforce that, those bones will continue to shift. As I share with adults, it is easy to do a renovation on a house that's standing straight. It is harder to do a renovation on the Leaning Tower of Pisa and not have it fall over. And so with Sister, she needed that decompression to help her legs, and then we needed to support her spine. So we then helped rebuild that and improve some of that, and that's really been able to help her with her back pain and her leg pain.
I loved Dr. Place already. He was there always ready to help. Are you okay? I remember that. And I could tell him if I was feeling sick, we'll do something about that. And everybody at SLU Hospital was very accommodating and really tried to help in any way possible.
She did very well post-op. She progressed as anticipated in terms of going to rehab, and she got back to being fairly active. The woman is hard to keep down. She runs a food pantry in South City, and so she's been very appreciative of the fact that now she can do a lot of things, walk, and serve others. So she really feels like I helped serve her, and so she's serving others.
This is a picture of Sister today, and this is a picture of Sister back in 2010 when she originally presented. They are significantly different. Though it looks like, boy, she's been totally rebuilt. She loves how she stands, she loves how she functions, and she's especially happy that she can stand as long as she does, continuing to serve others in her food pantry.
I have the honor and the blessing to be here at St. Anthony's Food Pantry. You know, it fits me because with my surgery and with rods in my back, I love to stand. It's a job, it's perfect for me. And I know people always say to me, oh, you know what it's like to have back pain. I have no pain. I have no pain, which is such a blessing.
It doesn't surprise me that she works from 7 to 7 every day. A woman who has amazing amounts of energy, and every time I think I'm working hard, I need to realize that there's people all around who are working as hard, if not harder.
When I was going for my regular appointments to Dr. Place, he always wanted to know how the food pantry. And of course, I'm all bubbly and excited about telling him. So he would always say, someday I might come to volunteer there. And after my surgery and I was doing well, he got in touch and he said, I'm ready now to come and volunteer, and this is what I want to see if it would work.
Sister Marie opened up her food pantry, and so with the students, we would go to the foot clinic, and she would get people who would be in need of foot care. And I get a group of volunteers, student volunteers. They come and provide the care, and I supervise that care for all the people who come.
The student sits on the floor and they soak their feet, they cut their toenails, they take care of their calluses, they rub them with lotion, and then they give them a brand new pair of socks.
I think people truly appreciate that. I think there's several who clearly are unable to take care of their feet on their own, and I would like to think that we're probably keeping some people out of emergency rooms, etc., because we're able to do regular foot care for them. You know, my wife is an active part of that clinic. I mean, I can't, when she is not able to help me with that clinic, it's really a noticeable loss. So she is a key portion of that who doesn't get recognized in any of this.
And it's been working wonderfully, and the students seem to enjoy it also, and our people are hugging them, you know, after they do their feet.
The clients are overjoyed. It helps me, it reminds me, and every once in a while I'm just reminded of the gift to serve. So I just had an opportunity with a gentleman who was a World War II vet. He was a Navy corpsman, but he basically was a butler for a Navy hospital in the South Pacific, and that was his service. But he had served courageously in the areas he did, and really had a great love for his country. He came in a wheelchair with just very challenged feet and hadn't been getting the appropriate health care. And so I actually asked the students to step aside. He was going to be mine, so I took care of his feet.
I wanted to get to the pantry to work. That was my focus. I wanted to work with the poor again, so I would do anything. And so it was like I just did what I had to do, and I was very conscientious about all my exercises to get stronger and stronger, and so I did.
It is really rewarding for me to see Sister Marie in the role that she provides right now, and to know that I, in some ways, helped contribute to that. She got better. She, and through the grace of God, really has done a lot to make herself better and get there. It feels great to have been a part of that process.
My back feels great. I can get around. I have no pain at all. And literally, I thank God over and over again because I love my job. I want to keep working as long as I can. And so I feel that it's such a blessing that I am doing so well.
What really kind of set us off was that one side of my back was bigger than the other, and so like I would have on not even like a super tight shirt, but just something a little more form-fitting, and it was super obvious. So obviously, like my parents were concerned, so we went just to my regular doctor, and that's when she was like, "You have scoliosis."
She was a bubbly, active, lively girl who was concerned about why she looked different and what was different about her back.
I didn't really know what it was, to be honest. I was kind of just shocked. Nobody in my family really had any back problems. I was kind of just hit out of nowhere.
So signs for scoliosis include things such as an asymmetry, some unevenness of your shoulders there, because scoliosis really is a three-dimensional deformity of the spine. It changes the shape both side to side, front and back, and then causes the spine to twist. And so that twist is actually the deformity that most of us see cosmetically. It's what the physician looks at when has someone bend over and look at their back and the unevenness of their back. I try to teach the residents and some of the students that if you actually move a young lady's hair who's always wearing her hair long, you can see deformity there because they recognize it in the mirror, but they just don't want to admit to it, and so they hide it by having their hair long over their shoulders. They don't go out with their friends and wear like bikini tops or things that other girls their age would because they're so self-conscious. So that's some of the emotional aspect of the disease. The medical aspects include breathing problems and long-term pain. Sometimes in some of our other conditions it leads to feeding problems, sitting problems, and I've seen it lead to a continual decline of your overall health and medical condition that, yes, some people die from it.
Nobody in my family really had any back problems. I was kind of just hit out of nowhere.
When she then saw her x-ray, she was somewhat appalled.
And what we see here is the deformity in her spine. She has this side-to-side curvature of her spine, which is what we call scoliosis. And I think it's relatively obvious on the x-ray, but it was also obvious when you noted Caroline and how she stood from that. Here is a picture of her from the side, the same. And with that, what we kind of don't appreciate much, but is how much her ribs are kind of uneven and how they stick out to the side.
Immediately, that challenges for some, I don't remember exactly for Carolyn, their sense of self-worth because their appearance is off. Carolyn's curve progressed despite our best attempts at trying to stop it from progressing, and it got to the point where we expected that would be a long-term problem for her and could possibly cause some future medical challenges. So we then had to talk with her about surgery.
Knowing that I was going to be away from all my friends at school, like I was going to have to go through all this, I cried a lot at first, and I was really, really just sad and scared too.
Caroline was somewhat precocious, and so she actually engaged in the conversation, asked interactive questions, and what about this, and what about this? And so those are actually the patients I really enjoy taking care of because they challenge me and I have to think of a way to relate to that adolescent about what they're about to go through.
Honestly, it was pretty comforting. He's a really friendly and outgoing person, and right away he made it very clear that if I ever had any questions, I could ask him. He wanted me to be comfortable. He wanted me to know what was happening, and the same way with my parents.
One of the things that's unique about spine surgery, I believe, is that there's different associated risks. There, I think, when things go poorly, things can go very poorly. And within the specialty of orthopedics, not as many people choose spine surgery just because some of those challenges. Knowing the non-surgical treatment for that and trying non-surgical treatment first is an important aspect of when to have spine surgery. Her surgery went off without a problem, and she did very well post-operatively, and she's progressed very well since her surgery, returned to sports, was able to play sports at one of our local high schools here, and is matriculated at the college, and she's done very well since.
I remember before surgery, I would always kind of think about, especially late at night as it got closer, if something happened,
all the things that I hadn't done yet at 13, 14 that I wanted to do. And so far, I've gotten to do a lot of it. I got to go to high school and play sports, and I'm in college now at St. Louis University, and I get to pursue my dreams and have like friendships and relationships, and it was really kind of my second chance, I guess.
She is a bright and bubbly, intelligent young lady who's continuing to move through. And I think, not that my surgery did anything to change her personality, but I think she didn't feel like she maybe had a flaw or a defect.
Dr. Place is one of the most kind, genuine doctors I think that a person could have. When he comes in to talk to you, he's very just upfront, he's funny, he's bubbly, he just makes you feel really safe. Even if you're scared and have questions, he totally makes you feel at ease and that everything's going to be okay.
What we did for Caroline is, after she was position prone, laying on her belly, we actually moved the muscles off of her back so I could look at the bones in her spine. Then hold on to those bones with a series of screws and move the bones into a different position. And as we move the bones into a different position, we connect those with a rod. And then lock that rod to those screws, and then the spine is in a different position. The last part of that is a fusion, where we actually try to get the bones to grow together, one bone to the next bone, so that it won't reoccur. So if I were to take out the metal, the spine would just bounce back to where it was. And so that's the last part, is to do a fusion and make that so that's a permanent change to her spine. And this is Caroline as she is today, and as she stands with a significant change from the front view to where she is today, and then her side view than she did before. She also has more curvature to her back, and her ribs are more even and don't stick out nearly as much as they did before. And I think that was a very successful procedure for her. Some children, in some instances, based upon the severity of their curve, will need something like me to reposition the spine by changing some of its natural connections so that I can put it in a different position.
If you don't get that fixed, your spine continues to turn, and eventually it would have kind of all collapsed in on my heart and lungs. So I might not even be here. So that makes me obviously really grateful to be born in a time like now where we have medical technology and the ability to fix problems like that, when maybe 50 years ago we didn't.
I expect Caroline should do very well and be able to lead a pretty normal life. Her surgical procedure did not go low into the area of her lumbar spine. She has great flexibility, and her risk for significant long-term problems is no different than the rest of the population.
Right away when I got to high school, I tried out for the tennis team, and I made it somehow. And I played all 4 years, and that was really fun. And I can exercise, I can pretty much move and just be normal. I don't even think about it most of the time. It's a part of me, but I've been able to have my own life and move on from that, which is really awesome.
I'm really blessed to work with a great team. I have some spine providers like Dr. Robert Morgan, who joined us a little over 2 years ago, who's just been a tremendous asset. A new addition last year is Dr. Portia Solari, who is exceptionally well trained, was with us before, and people are so excited to see him come back. Besides having a physiatrist who's joined our team, Dr. Tripp, and a physician assistant, Heidi Reeder, I think as a group we work very well together. We're supported very well by our nurses. Mike and Jen do a great job of trying to answer patients' phone calls and kind of keep them abreast of what's going on. And the nurses in the building, I'm lucky with the nurse managers, are just so dedicated and committed to our patients. Physical therapy, nursing, the folks in the OR. If I had to have my mother have surgery, my sister or my children or grandchildren, St. Louis University or Cardinal Gladson would clearly be the place I would. I'd get great support at both of those institutions.
I was absolutely blown away by the care that they took. Just the nursing staff, the physicians, they would come by every day to check on me while I was in the hospital. To have a physician not say, well, that's all I got for you. I don't know that there's anything else I can do for you. He, would talk with me, and make me feel very special as a patient. The SLU physicians are just wonderful, absolutely wonderful.
Genuinely care about their patients and care about doing new surgeries and like breaking boundaries and moving forward. And so every experience I've had with the SLUCare physicians has been really positive.
I told 2 other sisters about Dr. Place, and they both came after I did and have surgery, had same kind of surgery. Both were in wheelchairs. Both ended up walking and out of pain. And I trust them, and I knew that I could send 2 other of my sisters to them.
SLUCare gives me the opportunity to work at St. Louis University Hospital, which I think is committed to trying to provide outstanding care for the people in our region. I think it does that with its level 1 trauma facility. I think we are able to step up to the plate, and I think we're recognized by a number of different folks that when the trite as it may be, when things are critical, this is a good place to be, and I think that works very well.
Because I don't know that with any other doctor that they would push you to be this positive or have this outlook on life, even when your life has changed. You are very important to them, and that you are front line center, not a number. You are their patient, and they're there to take care of you. I really have no words. I feel like he saved my life. I feel like he is an amazing surgeon. He has this kind of stone-faced personality, but you start chipping away, and then you get to know him, and he is just kind, and he pushes you not past your limits, but he pushes you to push yourself past your limits.
I am very much into trying to help and take care of people and following the message of the gospel. What you do for others, you do for me. So when I see doctors or even our volunteers giving that extra time and that extra love, that says to me they're really living out and being their best selves and not just doing it for a paycheck, or for acclaim, but they're really doing it because their heart is in the right place. They want to help, and they're willing to help wherever help is needed.